Lumps under the eyes after injections of fillers is quite a common complaint. In this video, I explain why it happens and suggestions how they can be treated. The lumps under the eyes after filler injections, especially in the tear trough area, can happen for several reasons. The first is poor placement of the filler. If the filler is injected too superficially, that is, too close to the skin instead of deeper near the bone, it can create visible lumps or irregularities. Another reason is wrong type of filler being used. Some fillers are too hydrophilic, that is, they attract the water, which cause swelling and lumpiness over time. Tear troughs need soft and less hydrophilic fillers. Overfilling this area, injecting too much product can lead to puffiness, lumpiness, or heavy appearance under the eyes. The Tyndall effect is a well-known side effect. When the filler is being placed too superficially, it can cause a bluish discoloration along with the visible lumps because of light scattering through the material. Swelling or inflammation, which can be normal post-procedure and can be temporary. However, in some cases, it might persist if the body reacts to the filler. Migration is another common complaint. Over time, with the filler shifting from where it was placed and then move lower down, creating an uneven area. One has to choose the correct candidate for this procedure with filling under the eyes because some patients have very poor tissue support. These patients have very thin or loose skin under the eye. Any filler irregularity is more visible because the skin cannot hide the imperfections well. And another reason is technical error, where there is lack of proper technique leading to injecting too quickly, resulting in uneven filler distribution. The anatomy in the tear trough area is complex, and one has to pay particular attention to the poor lymphatic drainage in this area compared to other parts of the body. The lymphatic vessels are very fine and easily blocked. Swelling in this area leads to fluid being accumulated, leading to persistent swelling or puffiness. There are several management options, and the management would depend on the cause and severity. And the first option is to wait and see. As this area has poor lymphatic drainage, one can simply massage and gradually hope the fluid will disappear. And if the swelling or puffiness is caused by the filler, one may actually have to inject hyaluronidase to reverse the process, that is to dissolve the filler. Should a Tyndall effect occurs, one would need to reverse the process by injecting hyaluronidase because the filler takes a long time to dissolve on its own. So moving forward, prevention is most important. One is to undertreat the eyes rather than overtreat. So less is more. And the next factor is selecting the right filler, that is a low G prime or softer and less hydrophilic filler. Be very careful with patient selection, especially those with skin redundancy or loose skin under the eyes. And beware of concurrent pathology such as an eye bag in this area that could make the swelling worse.